So most of his fat, probably, I'm going to go against the grain here.
Welcome to Getting Understanding with Dr. Daryl Ellis. We're going to continue the conversation today that we began about the biggest pandemic, the biggest epidemic in this country, and that's obesity. How would you, I'm going to give you a scenario.
Okay.
I've got a gentleman who is 6 feet tall, but weighs probably about 280 pounds.
Okay.
His body mass index is probably somewhere in the mid 40s.
Oh, wow.
He has a history of hypertension, also has a history of diabetes.
Okay.
He's developed arthritis in his lower extremities. So he says that it's almost impossible for him to exercise. What we do is we go ahead and we take a food diary from him to find out how he's eating, what he's eating, and when he's eating it.
Great.
And what we find is that he, like many people in this country who struggle with their weight, have adopted a diet where, the best thing that I can do is just not eat or try to skip meals. I'm just going to eat one meal a day. And so this gentleman presents with his food diary. He doesn't eat breakfast. He just has a cup of coffee. He doesn't eat lunch because he's at work and he's busy. And then he gets home at around 6:30, 7 o'clock at night, and he has his one meal.
Right.
And his one meal is a traditional Southern meal.
Sad diet.
I mean, exactly. He has got him some meat. He's got some potatoes. He's got some gravy, and he's got a little bit of salad on the side. Or maybe he's got some
tea.
Right, and some sweet tea. Absolutely. And then by the time he's worked all day, he's eating this big meal. He goes and sits on the couch, watches a little TV, and then goes right to bed.
Right.
And he says, "Doc, I'm only eating one meal a day. How come I can't lose weight?" I said, "Well, are you exercising?" He's like, "Yeah, I walk all day while I'm at work." What can we do to help this gentleman?
Wow. I love this scenario because it's so classical in presentation. And I think what happens in so many people who are like that and are just confused as to why they are not losing weight. But I look at obesity from a different approach. I look at, I guess, what I would consider to be the total picture. And when I say the total picture is that one thing that I back up and lean into is something that you said and something that we will find on the initial evaluation: hypertension and diabetes. The big elephant in the room with him would be the diabetes, because he wouldn't be a classical patient that comes in who's a non-diabetic where I can look at diet in a different way. He is already compromised given the fact that he's a diabetic. So I'm now looking at the way that insulin is resistant in his body. And that alone, for me as a diabetic patient that I'm dealing with, kind of dictates, the fat storage and then the fat utilization. The take-home message for a lot of these people in the media and social media and even the dietetic world has been the reduction in carbs. And the problem I have with that is I think that we've been miseducated with that. And the reason why we've been miseducated is because we think carbs are bad. And we haven't been able to fully examine, explain, and even investigate the good of carbohydrates and the bad of carbohydrates. So right now we're just getting a blanket carbs are bad. And so you're looking at a diabetic that's saying, okay, I'm only eating one time a day because I want a reduction in calories. And while a reduction in calories can make you lose weight, it only is going to make you lose weight initially. And when you're thinking about that, I'm also going to look at whether or not this man has more visceral fat as opposed to subcutaneous or vice versa. And so for me, the dangers would not necessarily be his subcutaneous fat, because we can kind of modify that and change that immediately with getting him moving. It's that visceral fat, because once you have a storage of visceral fat, your body begins to produce cytokines. And when it's producing those cytokines, you're producing inflammation. So most of his fat, probably, I'm going to go against the grain here, is not coming against his overeating. It's probably coming from the inflammation of all of those cytokines being produced in his body because of the visceral fat that he stored. And so what I try to do is try to find out, okay, what foods actually causes higher spikes for him versus those that don't. And everybody is different. I'm a diabetic and I can eat a banana and it's going to shoot my blood sugar up so high versus another diabetic that can eat a banana and it does virtually nothing. The glycemic index for them, it actually is not the same. And we've been thinking it's been the same, for me versus you. I guess the short answer, Doc, would be is kind of looking at that, measuring if I can, the subcutaneous fat by, calipers, and then probably looking at whether or not he got some fatty liver disease, getting some scans on him. And I know that sounds more medical than what I should be doing, but it's because I'm a medical scientist. And when I'm looking at all the ways that drugs actually is absorbed, distributed, metabolized, and excreted in the body, I have to know all of that. So I'm kind of coming to diet approach with a more scientific base than just somebody saying, okay, let's find, avenues and pathways to help you lose weight. We know that weight loss and weight gain has to do with a balance or an imbalance of energy stored and energy utilized. And that preferred source of energy is carbohydrates. And so when you're starting to see all of these fad diets that are coming out with low carbohydrate, I wonder how much of that works. We know that it works immediately, but then it stops. But what we're not thinking is how it damages the brain. And the brain is the only organ that carbohydrates are necessary for. So when you see these people that go on these diets, even as a diabetic, and I just scream because they'll say, my endocrinologist, put me on this, low carb diet. And, I lost 10 pounds or 15 pounds right away. And it stopped. Well, then now I start looking at their muscle atrophy. Because what happens is, they initially begin to lose some of the subcutaneous fat, but it doesn't convert over into visceral fat burning. It actually converts into muscle destruction. And so you see these people that lose weight, but they look so malnourished. And then they come in now with extreme malaise and fatigue. Well, that's because they've broken down muscle that they need. And your heart is a muscle. And all these other organs in your body are muscular. So, there has to be a proper balance of how we look at energy. And a lot of times, insulin gets a bad rap, and sometimes insulin is rightfully accused. The short answer is really looking at the kind of carbohydrates that he's consuming, and then how his body is responding to certain carbohydrates, because all carbohydrates are not created equally.
We thank you for tuning in. We'll be back next with a little bit more information from a different perspective on how you can achieve your weight loss goals. God bless you.